Mr. Parikh, we often have pregnant women who come and complain during pregnancy of a feeling of very blocked nose. Is that something that happens in pregnancy?
There is a condition where pregnancy is associated with rhinitis, and about 30% of women actually suffer from the symptoms of rhinitis, which are a blocked nose and a runny nose. And this happens particularly in rhinitis. And there are two types of problems during pregnancy that give rise to this problem, i.e. rhinitis. There are a group of patients who already have allergic rhinitis, so they have trouble outside of their pregnancy with allergies, nasal allergies, so grass pollen allergies or dust mite allergies, which during their pregnancy gets worse, and they start having increased symptoms of nasal obstruction or a runny nose. But there is another condition which is specific to pregnancy, and that is called gestational rhinitis. So in these patients, you find that it usually comes on in the second and third trimester, particularly. And the interesting thing is that once the baby is delivered, after their pregnancy, completely resolves in about 2 weeks. And that is a specific condition. And I would say, from my reading of the subject, about 10 to 15% of women will have gestational rhinitis. So that is a particular condition for them. So we come across both kinds. The problem that women who are pregnant face is that in any case, because of the pregnancy, they have some difficulty in breathing, particularly at night when they are lying flat. And when they develop rhinitis, it even gets worse. And so they then seek help. But if it is very marked, or if the symptoms are particularly marked, they then seek help. And we give them advice on how to deal with it without medication, because some of the medication is contraindicated and some of the medication is not safe to use in pregnancy. So the common things are that they should sleep at night with a few pillows, which they might be doing anyway because they have reflux issues. They can use just a simple saline douche on a regular basis that cleans the nose and gives them a better airway. Despite this, if they do not improve, then they will need some medication. The over-the-counter decongestants that are usually used for colds are contraindicated unless they are used for 2 or 3 days. Right. And certainly not in the first trimester, because there are some, it is still slightly controversial, but there are some studies that have shown that there can be problems with the child. Right. So we would say certainly in the first trimester, no drugs at all. In the second and third trimesters, maybe for 2 or 3 nights so that they get a good sleep. And that's the decongestants. The other medication that we very commonly use are intranasal steroids. And I do use these in women who are pregnant in the second or third trimester, but again, only reserved for, say, 2 weeks, nothing longer than that. Mm-hmm. And one of them, budesonide, has been proven to be quite safe. So that is really the treatment. And most women are quite happy to take just some conservative measures using the saline douching and sleeping with a few pillows, and they try to tide over, yes, go over the whole period. Mm-hmm. Yeah.
Does it get worse as the pregnancy? So if it starts second trimester, does it
yes.
get worse as you
So it doesn't
progress?
Actually. No? That's that's an important question, but that it isn't particularly related to the duration. Also, in gestational rhinitis, once women have had it, they are aware of what's going to happen with the subsequent pregnancy.
Okay. So it's likely to come back
Yeah, it is likely to come back, yeah,
during another pregnancy.
And this is related to hormonal levels. Several studies have been done, and it can be estrogen related or some of the placental hormones, but nobody is 100% sure as to why it happens.
But there can be relief
yes,
sought
there can be.
either by natural means or then
absolutely
come and consult and
I mean,
if it doesn't get better.
So the important thing is we will obviously examine them, see if there are any other issues that are giving rise to their nasal blockage, and if it is just simple rhinitis, then this is how we would manage them.
All right, Mr. Parikh, thank you very much.
Thank you.